Ultrascan diagnostics. So this is the CBCB of the patient that you had requested. The area of interest is the lower molars, wisdom teeth for extraction and their association with the inferior alveolar nerve. Now, starting with the lower right wisdom tooth, as you can see, has a medioangular impaction. Now, we are going to shift to the transaxial view, which is basically the proximal view. So here you will be able to appreciate this is the medial aspect of the tooth. As you move towards the distal aspect, you can see that there is the body, and then we've got the mesial and the distal roots to they start to appear. And here it gets interesting where the medial root is very closely associated with the inferior alveolar nerve right there, which is highlighted by this orange dot. Now, the medial root is definitely in contact. This at the interradicular area, both the roots are now in contact with the nerve. So definitely, there should be caution when extracting because there is compression of the nerve. Moving to the transaxial view of the left hand side, here we have got a horizontal impaction. As we are moving distally, you will be able to appreciate that the tooth is horizontally impacted. We've got the two roots here, the mesial and the distal. As we move towards the apex, we see that the nerves, the inferior alveolar nerve comes close to the apex of the wisdom teeth, but it does not come in contact, so there is no compression. I will even remove the highlight here so that you can see that there is no significant compression. This is where the nerve is, right here, and this is where the apex of the tooth is. So definitely no compression in terms of the left hand side, but the right hand side definitely has compression and is very closely associated. This is the axial view or the top to bottom view. Here you can see that we've got wisdom teeth. This is the left hand side, this is the right hand side, and as we move towards the inferior aspect, you'll see the right hand side, the nerve is significantly close. On the left hand side, there still is a little bit of a distance between the inferior alveolar nerve and the wisdom tooth. Thank you very much. This is the coronal view, and here also you will be able to appreciate that this is the right hand side, this is the left hand side, just to give you a better idea or a slightly different view as well.